Today we've been responded to a 16-year-old girl at a gym who is short of breath and has a query wrist fracture. We've already taken a full set of baselines and it's come back as a heart rate of 110, a BP of 140 over 90, an SpO2 of 97%, a rest rate of 28, a temperature of 37.2 and a GCS of 15. On arrival, we find the patient sitting down in the tripod position. She's looking pale and the patient is obviously short of breath. She's using accessory muscles and breathing faster than normal. However, there is no nasal flaring or obvious neck or chest in drawing. The patient's right wrist looks deformed and swollen with obvious contusion.
Hi there, I'm Sophie. I'm a student paramedic. What's your name?
Sylvia.
So when doing a respiratory assessment, it's important that we keep our questions closed, as Sylvia here is quite short of breath. So Sylvia, how long have you been feeling like this for?
Only a short while.
Okay. And did it come on suddenly? Yeah. Okay. Have you got any medical conditions I should know about?
I've got asthma.
You've got asthma. Okay. Have you had asthma recently?
Not recently, but I've had it for a while.
Okay. Does it? So I'm assuming since we're at the gym, you've been exercising. Does it normally come from exercise?
Yeah, it's exercise induced.
Okay. So you haven't had it for a while. Is it normally this bad?
Not normally.
Not normally as bad as this?
No.
Okay, so what I'm going to do is I'm going to have a little listen to your lungs. I'm just going to listen to a few lobes, so just there, and there's going to be some under the shirt and some at the back as well, okay? I may need to get you to sit up just a little bit so I can have a proper listen. I'll get you to do big, deep breaths in for me if you can. Okay, so I can hear a wheeze there. And your wheeze is there as well. I can hear wheezes at the bottom of the lips as well. So I can hear wheezes in all of Sylvia's lobes in the front and the back, which is a huge indicator of this being asthma, especially since she has a history of asthma that is generally induced by exercise as well. It looks like Sylvia is suffering from moderate asthma at the moment, as she can get words out and she's able to move air in and out due to that loud wheeze I'm hearing.
Once the patient used their metered dose inhaler, the asthma subsided and she was now able to breathe at a normal rate of 16 breaths per minute. We performed a second auscultation on her lungs and found that the loud wheeze was no longer there and it was now sounding clear in all four lobes.
So now that I've controlled Sylvia's breathing, I'm now going to try and get a bit of a background of the story of what's happened. Now that she can talk full sentences, it's going to be a lot easier to get the information that I need from her in order to assess her wrist. So Sylvia, what actually happened to your wrist today when you were short of breath?
Well, I became short of breath and then I tripped on the treadmill and then tried catching myself and landed really awkwardly on my arm.
Okay. Did you
I kind of just
land?
I kind of just stretched it out to
Stretch
the
your arm
barrier.
out? Okay.
Yeah.
Okay. So to assess the wrist, I'm going to be using the PLUS-TIS acronym. This is to determine the likelihood of a fracture. So Sylvia, how bad is the pain? So 0 being no pain at all, and 10 being the worst pain you've ever felt.
Probably a 7.
7 out of 10?
Yeah.
Okay, and does it feel like kind of achy pain for you?
Definitely.
Yeah? Okay, are you able to move that at all? Or is it too sore?
I don't want to.
It's too sore to move? Okay, just gonna have a little bit of a feel of your arm. Okay, you just tell me where it feels most.
Yeah.
About
Right
there?
there. Yeah.
Okay. So due to the fall and due to the pain being there, it's likely that we've got a distal radius fracture here. I can also see that there's obvious deformity and swelling and contusion around the wrist there. Now that I determine the likelihood of a distal radius fracture, I can then assess the cardiovascular and neurological integrity to ensure that there is no arterial bleeding or blockages. I'll do this by firstly feeling for a distal pulse. So I'm just going to have a feel of your wrist here, just to feel for a pulse. I know it's going to be a little bit painful, but just bear with me, okay? So I can feel a strong and regular pulse there. I'll also do a capillary refill. And she's got a refill of about 1 to 2 seconds. I'll then check for colour differences, which I can't see any obvious colour differences apart from the confusion around the right wrist. I will then need to do a full check for compound fractures and bleeding around the wrist.
It was clear that the patient was suffering from an asthma attack due to her age, history, the acute onset of shortness of breath, and the loud expiratory wheeze sound in all 4 lobes in the lungs. If we had heard crackles of fluid in the lungs, we may have considered pulmonary edema, pneumonia, or bronchitis. If the patient only had a wheeze sound in 1 lobe of the lungs, a chest infection may have been considered. I believe that the patient was suffering from a moderate asthma attack rather than a mild or severe attack because she was able to speak in short sentences and could move enough air in and out in order to generate a wheeze. The patient didn't have any significant chest or neck indrawing, and this is usually present in a patient suffering from a severe asthma attack. When assessing for a fracture, the plus-DISC acronym is a good way of determining whether the patient needs hospitalization for an X-ray or further treatment. The patient had obvious signs of fracture due to the deformity and contusion and swelling. The patient didn't have any obvious wounds or bleeding around the fracture site, which ruled out the chances of a compound fracture. Due to the mechanism of her fall and the crepitus on palpation about 1 inch from the end of the radius, it seemed likely that the patient was suffering from a distal radius fracture.